Hello, my name is Esther Lisinge. I'm a family nurse practitioner um, and a postgraduate DMP student at Branham University. This is our stakeholder educational plan for our clinical scholarly project, the CSP. Our agenda today is to present a plan of stakeholder education about our evidence-based practice project. During this presentation, we shall be providing a brief description of our stakeholders group and each group role in the project implementation. We shall identify educational need for each group, discuss the theoretical foundation conceptual framework underlying our proposed CSP intervention. We shall outline a plan of delivering the intervention. PECOT question. In morbid obese patient, does laparoscopic sleeve gastrectomy as compared to pharmaceutical therapy, diet and exercise relieve or eliminate CVD, reduce weight and mortality in 3 months? Identification of stakeholder groups. Our stakeholders are all individuals or organizations who are directly or indirectly involved in our project and whose interests may be positively or negatively affected as a result of our project execution or successful project completion. Savage, Nix, Whitehead, and Blair, 1991. According to this author, each stakeholder will make a demand on and have an expectation of the clinical project. During this identification process, we shall collect ideas and assess the need of these stakeholders. First, we shall have a face-to-face meeting with our stakeholders to identify the stakeholders' value, belief, assumption, and expectation. During this first meeting, we want to establish which stakeholders' resistance is likely to inhibit the success of our CSP and which change we can make to ease the acceptance of the CSP. To help us identify the stakeholders' position on the CSP and their importance, we shall establish the stakeholders' levels of power. We will take into consideration the stakeholders' knowledge, skills, their influence in the organization hierarchy, their level of control of strategy resources, and their ability to exercise freedom of choice. Savage, Nix, Whitehead, and Blair, 1991. Stakeholders in Group A. There are stakeholders who lack power and low interest in our CSP. We anticipate that these stakeholders will be managed and are most likely to accept what they are told and follow instruction. Medello, 1987. Patients, family, and friends, medical assistants, scheduling clerks, our casual unskilled staff. Stakeholders in Group B. These stakeholders will have power with low interest in our CSP. We anticipate that these stakeholders will be influenced and we have to keep them satisfied with our CSP, always reassuring them of the likely outcomes of our project as we progress. The stakeholders are the state and the federal health department, the local community, non-profit groups such as the American Obesity Association. Stakeholders in Group C. These stakeholders will with low power and high interest in our CPS. When communicating with our CPS to them, we shall present it logically and show that our CPS is rational. We have to integrate them into the CSP such that they don't join forces with powerful dissent to stop the project. The stakeholders are clinical leadership, patients, clinical staff, and other skilled providers. Stakeholders in Group D. The stakeholders are key players who have power with high interest in our CSP. We anticipate that these stakeholders have a financial interest, motivation, emotional drive, and are interested in maintaining organizational and individual performance and image. Marshall, 1987. They will be the primary driver of our CSP. We need to discuss our project objective, financial obligation, and implementation strategy. Mendello, 1987. The stakeholders are Branham University Review Board, upper management, and physician. Stakeholders' role and educational need. The objective here is to develop our engagement and build an understanding with all stakeholders depending on their scope of influence and their aim for buying into our CSP, pointing out the opportunities derived from our CSP. Stakeholders in Group D, their roles. approve our CSP, provide strategy for implementation of our CSP, provide immaterial and financial resources for our CSP, provide feedback and project follow-up. Educational needs. Provide background and significance of the project as an opportunity and not a threat. Provide a strategic view of how our CSP align with their mission, belief, and values. Show how the project will bring about value-added care for morbidly obese patients, reduce hospital readmission rate through the provision of effective, efficient, and economical treatment and improve patient satisfaction score. Information about project cost analysis and that will indicate the cost effectiveness of the treatment of morbidly obese patients, showing expected short and long-term financial benefit to individuals and the organization of our project. We shall be sending a monthly email informing these stakeholders about the progress of the CSP and request feedback to carry out any necessary adjustment to program implementation strategy. We also intend to have a face-to-face project presentation during providers meeting to discuss the project. Stakeholders in Group C, their roles. Documentation of the patient's assignment and clinical evolution. Organizing clinical data for required analysis, management of patient data CSP, participate in CSP patients, coordination of CSP and providing feedback. Educational needs. An in-depth education of the objectives of the project, its implementation and expected outcome. Education on desired patient satisfaction with the best evidence-based practice, increase quality and daily and decrease daily. How to collect valuable and analyze CSP data. We intend to send emails and also have a face-to-face project presentation during monthly in-service meeting to discuss the project and get feedback. Stakeholders in Group B, roles. Identify community assets and strengths that will help with the CSP. Ensure the intervention of relevance receive maximum attention. Obtain buy-in from the community and encourage collaboration. Provide feedback. Educational need. We need to educate this group about our option of reducing public spending by preventing patient readmission and reducing daily through advocating for an efficient but cost-effective treatment option. We also need to educate this group of our desire to increase our productivity. We shall educate the group about opportunity of using our findings to develop protocols and follow educational purposes. Stakeholders in Group A, roles. Collect valuable CSP data, perform other duties as needed, provide social and material support to patients during CSP. Educational need. Information about the program outline, HIPAA rules on handling patient data, provided with materials and education on how to collect accurate CSP data. Inform any redundant social support needed over time. Florence Nightingale Environmental Theory. The therapeutic aspect of this project is a very critical pillar of our project and depends mostly on the environment of care and the patient's reaction to the care plan. Florence Nightingale is attributed with establishing the environmental theory, which incorporates the patient's surrounding environment in his or her nursing care plan. In this theory, the role of the nurse is to use the patient's environment to help him or her recover and get back to the usual environment. Petiprin, 2016, Salanders, 1998. Nightingale emphasized providing a quiet, warm environment for patients to recover in. The theory also calls for nurses to assess a patient's dietary need, document food intake times, and evaluate how the patient's diet affects patient's health and recovery. Pertinin, 2016. Patient dietary needs are very essential for the patient population we are dealing with in the CSP. Intervention delivery plan. We intend to carry out our CSP in collaboration with Houston Medical Northwest Center after obtaining the approval from Brandman University Review Board, the bariatric surgery team, and the administrative team of Houston Northwest Medical Center. Why Houston Northwest Medical Center? The medical facility has attended effectively to the community of North Houston since 1973. The medical center is devoted to improving the well-being of this community by providing an excellent personalized health care. Bariatric patients now have another option for weight loss surgery at the North Houston Medical Center called the laparoscopic sleeve gastrectomy. Our CSP will be carried out in 2 phases. For us to provide a high degree of evidence to the stakeholders for our CSP, our project phase 1 involved a systematic review of literature that is relevant to the project. This phase has provided us with information on the prevalence of morbid obesity and why it is a crisis, and necessary background knowledge of our CSP topic. The second phase will involve a follow-up of the 2 groups of morbidly obese patients, the performance of a pre- and post-implementation treatment performance analysis and cost-benefit analysis to come up with the cost effectiveness of each therapeutic method. The first group will be patients who are undergoing the laparoscopic sleeve gastrectomy therapy, and the second group will be patients who are undergoing the pharmaceutical therapy. The follow-up and data collection will be both at the hospital and at the patient's residence. At the end of the project, we shall evaluate which of the group has responded most to the treatment. Our performance measures will be percentage reduction in weight, mortality, review or elimination of CVD, increase in patients' quality adjusted life years, and decrease in disability adjusted life years. Reference and citations used during this presentation are shown below. Thank you for listening to my presentation.